Hello guys, welcome back to my channel which is Real Homeopathy. Please do like, share and subscribe to my channel, and for more updates stay tuned and press the bell icon given below. Today I'll be explaining about the miasms of psoriasis. So firstly we need to understand what are the miasms and what is the psoriasis. So this is what we need to primarily understand. So let's move on to the class. So psoriasis, it is a hereditary-familial chronic recurrent inflammatory disease of the skin of unknown origin, which is characterized by well circumscribed erythematous dry plaques of various size, which is covered with mica-like scales. So this is psoriasis, something which is hereditary-familial chronic recurrent. So it is coming from hereditary history, something like anyone is having in the family, or hereditary type of this thing, and chronic, which is since many days, and it is also recurrent inflammatory disease of the skin. Psoriasis, will see the clinical features of it. There is an initial lesion. It is a papule covered with silvery scales. Papule gradually enlarge peripherally and scales increases to a mass. So removal of the scale exposes a thin membrane, and removal of it causes pinpoint bleeding points. Next, varieties which is coming under the morphological conditions. There is a punctate psoriasis. Punctate means which is a pinpoint size psoriasis. Guttate psoriasis means like a drop size. Namar, which is a coin sized. Annular, which is a ring shaped. Gyrate, which is annular merging with one another. Pustular, sterile pustules, which is in crops. So these are the 6 varieties here. Again, coming to this was varieties which comes under the morphological, which is in the size. Regional means the areas in where it happens. So corona psoriatica, which is surdings of the hairline. So this is corona psoriatica. Flexural psoriasis, which is intertriginous area, which happens in the axilla or in the grayon, which is a flexural psoriasis. Palmar and plantar psoriasis, which occurs only on the palms and the soles. Next, coming to, there is a scalp psoriasis. Later we see there is a arthropathic psoriasis, which is all related to joints of the fingers, feet, knees, ankles, distal interphalangeal joint involvement, which is typical, and there is deformity, so seen as arthropathic psoriasis or psoriatic arthritis. Next, come into patients of the nails. Oil drop sign or a Cobner's pneumonia phenomena. Erythrodermic, which is skin, serious in elderly. Erythrodermic psoriasis. So that was about the regional and the morphological varieties of psoriasis. So next, coming to miasms in psoriasis. Psoriasis, according to the theory of chronic miasm, is the condition of 3 great miasms, which is psora, sycosis and syphilis. Dr. H.A. Roberts says psoriasis has been called the marriage of all the miasms, but its characteristics are predominantly psoric and psychotic type. Dr. R.P. Patel, psoriasis is a condition of 3 great miasms, psora, syphilis and psychosis. It has more of psora, a pinch of psychosis and a lot of syphilis. Dr. Samuel Hahnemann says classified psoriasis and its varieties, variants like psoriasis diffusa, invertebrata and syphilitic psoriasis under the miasm psora. Psoriasis developing in specific locations of the body, such as on the eyebrows, on back, on upper limbs, over elbows, forearms, hands, palms, fingers and on legs, are also classified under the psoric miasm. Next, Dr. J.H. Allen says Psoriasis and its variants have all three miasms in their formation. More psychotic element in psoriasis of eyebrows, psora and sycosis predominant back, upper limb, elbow, forearm, hands and palms, fingers and on legs. That all comes under the psora and sycosis. Skin symptoms which is similar to psoriasis and its miasms. Other skin symptoms which are related to or which are similar to that of psoriasis. Psora, skin, eruptions of all kinds in which dryness predominates. Bran like scales, tendency to reoccurrence, or there is a recurrence of the symptoms, and there is a scratching eruptions followed by dry scales. Skin cannot endure water and often has an unwashed, unhealthy, dingy look. Sycosis on skin. This was the psora on the skin. So next coming to sycosis on the skin, there is a disturbed pigment metabolism like hyperpigmentation of the skin. Fish scale eruptions with thickening of the skin, itching which is pruritus with thickening of the skin, symptoms aggravation change of weather which is damp or taking meat, thick nails with ridges may be irregular, joints and connective tissues are involved in the psychotic tendency. Next coming to pseudo-psora which is skin. This condition is obstinate and difficult to cure. Recurrence is there, periodicity is there, alternations are there, hemorrhage are the characteristics of this pseudo-psora, and it is obstinate kind of, and it is difficult to cure kind of. So this was it for all about the psoriasis, and if you have any queries based on the psoriasis, you can just DM me, and yes, kindly like, share and subscribe and stay tuned. Thank you.